Hi, I am Jannathul Firthous. I am from Bangladesh. I was suffering from my leg problem. That time I have no idea what happened with me. When I walk, I could not walk properly. I could not sit properly. So when I sit, that time I face problem and something is tightened in my hip. That is, I feel my problem, and looking at my problem, I consulted a doctor in my home country. He suggested me I need to surgery both side hip replacement. As per the doctor advice of bilateral hip replacement, one of my family members suggested me I have to come Bangalore for my treatment and for expert advice. I came to Bangalore and I meet Dr Prashanth B N at Narayana Hospital. Before I got to know I need to replace both sides. After meeting Dr Prashanth B N, he suggested me I don't need both side hip replacement. I just need to replace my left side hip replacement. My right side was called decompression. After surgery, it's been 8 months. Now I am fully fit and fine. I can work. I can do everything. I can sit properly. I can do my daily activities.
Hi, I am Dr Prashanth B N, orthoplasty surgeon working at Narayana Health City. I mainly do replacement surgeries of the hip, knee and shoulder and elbow as well, and do revision replacement. We also perform robotic surgeries. So one patient by name Jannathul Firthous, she came with the hip problem few months back. She came with a wheelchair saying that she is not able to walk. She has severe pain in the hip. That started after taking some medication for her skin lesions. And on evaluation, we found out that she has developed avascular necrosis of femoral head, which is at early stage in her right hip and at a later stage on her left hip. So then with the MRI scan and other things, we came to know that the damage on the right side is not that severe and left is bad. So we planned for a hip replacement on the left side and did a cold decompression on the right side. We explained her about the pros and cons of the surgeries, and she readily accepted that if the right side, the disease progression is not stopping, then we at a later date need to do a replacement of the right side as well. And post-surgery, her events, everything went well. So now she is after 8 months coming for follow-up. Her left hip is doing fantastically well. Her movements are everything is perfect, and on the right side also her movements are going good, and our repeat MRI scan shows that the avascular is revascularized and the damage on the right side is stopped. And presently she is happy. Her movements are almost normal. She would like to continue her studies, going to college, which she has stopped because of these issues. We feel very happy to hear that she is getting back to college.
Hi, so I'm Isha. I'm working with the physiotherapy department with Narayana Health over here in MSMC Ortho. I have treated Jannathul Firthous. She was a total hip replacement case that was given to me. I had taken care of her rehabilitation. She was a very, very cooperative patient, which is very important in our line because we need to have a good understanding between the patient as well as for our treatment to happen on track. We initially started off with exercises, very preliminary exercises from the hospital, and after which I followed up also. She used to come to me regularly and we gave her quadricep strengthening, hamstring strengthening, calf stretching and a lot of walking after that. We started her walking with the help of a walker. Slowly weaned it off as she could start becoming a little more independent. As she was a younger patient, it didn't take us a lot of time to rehabilitate her sooner and getting more independent. Almost by the 3rd day of her operation, we were able to get her to the washroom by herself. And our main purpose is to create independency for the patient more than, getting them to be under support of any kind of aid or somebody else.
Now I am completely pain-free. I would like to thank Dr. Prashanth B N and my physiotherapist Dr. Isha Devdas, and I also thankful entire team of ortho wings at Narayana Health City.
So these replacement surgeries are presently doing their best part. They have very proven results provided the implants are used well and the surgical techniques go well.